as Alex said, there's an awful lot of different things to consider, and there's an awful lot of different parts of the process. Okay, so with this chair, we are trying to follow the journey of the condition with the individual. So we will look to have various parts of adjustment within the chair. The main one that I was really feel is important, that was talked about a lot by Alex, is actually width adjustment within the chair. So we want to follow the person on their journey. We want to ensure that from start to finish they're supported correctly. And so with this chair, as standard, we have got width adjustment. We can start out from anywhere here, so it's around 22 inches in seat width, and then we can actually bring that seat width in, and we can actually lock it off as time goes on, as weight may be lost as a result of the condition taking hold. So we have got quite a bit of adjustment on both sides of the arms there. Now, one thing that's important about that width adjustment is we need to ensure we're able to fulfill that without, as was mentioned as well, the risk of entrapment for the patient. And so it's actually housed within a very padded and very secure cushioning around the outside of the arm of this chair, so we're not actually going to cause any injuries or any risk to the client there. Now, we have limits on the width as far as we can go here in terms of the frame of the chair, but if the patient will continue to losing weight, we have also then got our adjustable cushioning here, so we can actually, if needed, we could take some cushioning round, we could drop the lateral cushion to the base of the chair, we can actually decrease the width even further, but not actually cause too much discomfort in the process. That would still support, it would still keep them safe, but it is also, you know, giving them it's keeping them nicely central in the chair, and obviously just fitting to the dimensions of the patient. Now, the other thing we've actually done with this chair is we've got a depth adjustment capability. Now, obviously we're dealing with people with all different sizes and shapes, so the idea of this is that we could, if you've got a number of different clients that you're considering, you've got one patient that's in need of it now, and then another one comes up a bit further down the line. We can use it for this client for as long as they need. You can then adjust the depth, either bringing it forward or bringing it back, depending on the height of the person, and then you can reset it, redistribute, and away you go again. So the recyclability is there, and we've obviously assured that, again, it can follow the line of the condition for the individual, whether it's width or depth adjustment that is needed. Now, what we've also got here, and I'll be interested, Alex, to obviously just get your thoughts on this. One thing that wasn't mentioned but we have considered is quite often patients can struggle to regulate their own body temperature as well. So there's a lot of sweating that can happen. There's a lot of obviously that, coupled with the movements that we're talking about here, it can in some instances relate to shearing. You said yes, is that good?
Yeah, it's totally, yeah. Thank you for putting that in there.
That's absolutely fine. So what we've actually done on this is we've lined it with a mesh, rather than the usual result or solution for most of these chairs is Dartex. As great as it is, it does actually encourage, or can actually give people a bit more of a challenge when it comes to sweating. So this actually makes it breathable, and just prevents that from at least along the backrest side of things. It just ensures that that patient is going to be in a little bit more of a comfortable state. So again, trying to avoid that agitation, which then leads to other impacts following the way the condition transpires. So we've got that padded cushioning there. As well as that, though, what it also does is it just ensures that it's taking the force of those movements as well. All those movements that we were talking about before, that were mentioned, it's good, as you mentioned, about it being robust and soft. Those are the two key words, really. We want to make sure that we're actually going to support and manage to weather the impacts and the movements that are taking place, but we don't want it to be at the cost of the client who's having to sit in the chair. You know, we don't want them to be injured. We don't want them to feel the pain and the force of what's going on. And so the padding of this chair ensures that they stay comfortable. The reinforcement at the base and the backrest of this chair ensures that they're going to be able to withstand the movements that are taking place. We've also got the lateral cushions here to ensure that when we're transferring in, that we're managing to find that good midline. Again, as Alex has said, if the client doesn't want to, if they want to adjust themselves, they're going to do it, and they're going to get to a point where they're probably comfortable. It might be diagonally lying across. as you said as well, we're not looking for perfection, but it will ensure that they're supported within the safety parameters of what the chair can fulfill. The arms themselves as well are also nicely padded, as was stipulated before. Definitely a thought we were considering, and the risk of entrapment is very much minimal. Now, in terms of the movement on the chair here, in terms of what we're wanting to achieve, oh, by the way, we do have 4 brakes casters as well. Very much important. You mentioned it, Alex. I'm glad you did, because we agree with you there. You do need to be comfortable and supportive as much as possible, and also safe with this. But on this chair itself, what we've actually got here is the tilting space function actually deepens the seat rake on the chair. So what that ensures is that they're nicely cushioned, comfortable, set back in the chair. What this is doing is it's giving a good seating posture. So we're getting that pelvis nicely back, we're giving a good position there. But it's also keeping them safe in the sense that we're not going to be slipping or falling out of the chair as a result of the movements that are taking place. So if I just demonstrate here, there's little risk or chance of me actually coming up and out of this chair now. I'm nicely supported, and I've done that without the need of the belts and other things that can be seen as a restraint that were mentioned before by Alex. You know, the idea of this is we want to maintain as much comfort as possible. We want to ensure that the client is seated correctly as best they can be, and is able to just get the best comfort and posture out of the chair without having to keep them back, force them into a position that they might not wish or like in that respect. Now, the final thing that I'll run through on here just to finish things up is, as again was mentioned, sometimes they might have a preference to keep feet on the floor. So we've got that option for this chair. You can do that quite comfortably. But if you felt they actually needed more support there along the legs, we do have a foot block that can come along the side here, clip into place. Again, we do have 4 casters braked on this as well. So you've doubled that up, you've just got the 8 casters in total. But what we can then do is we can ensure, if a client is then hoisted into place, that this is going to obviously be down in, this can be attached afterwards. It can keep the legs in a nice upright position. And I'll just demonstrate quickly. You can see there that we've got a good line of support within place. The comfort and the arms and everything, the support there, the support of the lateral cushions at the back. We can adjust the cushioning at the top. We can add extra head support if we need as well. We've got a good range, a good overall picture here of being able to support this client comfortably without any needs of extra belts, buckles, or the bits of restraint here. Just a quick one on the leg block. It is a channeled leg block, as you can possibly see from the front. So we are following a nice shape of the legs. And importantly as well, we're actually holding the same line or falling in line with the end of the seat cushion as well. So there's no break in terms of where the leg finishes. We're not set up too high or too low, so that leg is getting a nice full long support from the back of the seat cushion through to the end of the foot block here that follows as well. And it just ensures that we're able to give a bit more flexibility, a bit more range to the individual in the chair. Like I say, it is a hoist friendly chair. We do have cutouts here at the side, so you can get your hoist right in where we need to be, and we can get ourselves right into the back of the chair. But it also does give capability to transfer into the chair if you need to as well, if the patient is still standing. So we've tried to cover as much as we can, but as Alex has said, you've got to look at it case by case. We've got to consider the environment, we've got to consider a number of different factors and things to ensure that we're getting the best sort of solution out there for your clients. But that is the Lento Neuro in a nutshell. Appreciate you taking the time to be with us today. If you have any questions or queries on this, please do get in touch with us. If you've got people in mind that you want us to assess with, I'll gladly come out and do that as well. But yeah, we'll hand it over for questions if you have any.